I'm G. Merceau, County Administrative Officer. I'm here to make a few comments about the county's response to the COVID crisis, and to give you a timeline of what brought us to this point and where we go from here. So I want to start by saying how much I appreciate all of you in the county family and what you're going through. I know this has been very difficult and trying on all of us. It's not hard. It's not easy to go home and be with your family and watch TV and see what's going on around the world. What we're trying to do is avoid what's happening in other parts of the United States, and certainly what's happening in other countries. I know people are running scared. My wife in particular is at home worried about me, here, and we all have to deal with that. But we will overcome. County management understands what you're going through, and we're trying to be as understanding as possible in dealing with helping you deal with this and help us provide county services as best we can. I want to let you know that the number one goal is to protect county employees and the public as much as humanly possible, while still providing essential services to our community. And I know that's a challenging balancing act, and I appreciate your efforts in trying to make that happen. I can assure you that the Board of Supervisors and County Management are doing everything we can to ensure your safety and the well-being and your well-being is being taken care of. We have and we will make mistakes along the way, and I ask for your understanding as we go forward. I'm going to give you a brief chronology of the last couple of weeks, the important dates that brought us to some of the actions that we took, so that you can be aware of if you're not already, by watching TV, of all what's happened the last couple of weeks. To start with, on March 7th, 2020, Fresno County had its first confirmed case. And let me stop here real fast and say I'm a very herky-jerky kind of guy. I have a hard time sitting still, so bear with me, because I'm going to be moving around quite a bit because I can't sit still. March 9th, so 2 days later on March 9th, we had a soft opening of our departments, of the Public Health Department of Operations Center. And that was to help monitor the situation, communicate with the hospitals, health providers, schools, faith-based organizations, and what have you. And Director Dave Palmaville and his team has done a fantastic job in that regard. 2 days later, on March 11th, we met with department heads, and I directed them to prepare business continuity plans and for the county to go to an essential service level approach. And the balance is to have enough folks to provide essential services, and what folks that aren't essential go home and should go home, send them home. So we really followed guidance from the Center for Disease Control out of Washington to address the following. We took action with our employees that are 65 years and older. We had them go home. We also identified employees with specific underlying medical conditions that were at risk with this virus, and we also have sent them home. Both groups with administrative time off for 14 days. Then I asked departments to identify their essential public services, to determine who could stay home, who could work from home, telework as we refer to it. And we recently approved a telework policy through the board, and we liberalized that policy in this emergency time to try to get as many individuals at home, in effect self-quarantining and protecting themselves and their family. We also had directed departments to reduce and or eliminate contact with the public if possible. And again, some departments can do a lot of work online or via the mail, and we directed them to protect our employees and the public to reduce the amount of contact with the public. We also reduced and eliminated all non-essential travel, certainly out of the country. We broadened it to be out of the state, and now we're broadening it to any travel outside the county should be discouraged. That's again guidance that's changing every day from the feds and state that we're putting in place in the county of Fresno. And lastly, we directed our Internal Services Department his director is Robert Bash. He's done a great job. His folks have done a phenomenal job to clean all the counters and all of our public contact areas to make our offices as safe as possible. On March 12th, Thursday, so one day later, Fresno Unified and other school districts announced school closures, and that created another challenge for county management, and that was how to deal with and how to help our employees who don't have daycare services available to them and have kids at home. So we expanded that list that I referred to earlier that was recommended by the CDC to incorporate these individuals, and allow them to take time off to take care of their kids where they had it, and we're even working with some employees who don't have enough time off accrued. We're going to advance time off that will eventually have to be paid back at some point in the future. But we want to reduce the impact to our county's employees as much as possible. On March 14th, last Saturday, seems like a lifetime ago, the second confirmed case was found. It was a little bit more problematic than the first case, so the following day on Sunday at the Public Health Department, we declared a local state of emergency along with the health emergency. The following Monday, this last Monday, we fully opened our Emergency Operations Center. In addition to the Department Operations Center that Public Health was running, they expanded that to a full opening of that along with the EOC. The Department Operations Center at Public Health is focusing on the response to the virus, working closely with the hospitals, healthcare providers, schools, faith-based organizations, law enforcement personnel, both fire and police and sheriff, just to try to provide guidance and direction during this difficult time, and also to coordinate services and supplies where we can. And I think the level of communication between that group is great, and it's going to be needed in the next couple of weeks. So to differentiate the two, like I said, the Department Operating Center at Public Health is focusing on the COVID operations in the community and the needs now and the potential needs going forward. The part of that group is a subgroup of that is a homelessness group that's being run by Dewan Utek and Sonia De La Rosa from my office, and to coordinate our response to the homelessness and try to get them off the streets and get them tested and so on. On the county side is our EOC, Emergency Operations Center, and as of right now, the focus is just on continuity of government operations. That's critical. We are the county. The government is an essential service as defined by the state in its emergency order, and we still have to provide essential services and keep the economy running. But at the same time, we need to protect our employees as much as possible, and we're doing the best we can, and there's more to do. This last Wednesday, on the 18th of March, the City of Fresno declared a voluntary shelter-in-place order. On March 19th, last night, the governor declared a mandatory statewide shelter-in-place order that we're still going through the details on how that impacts us. The reality is, from a county perspective, what we did in response to once we declared a state of emergency, we went to an essential services level approach, and that's really what's called for under the shelter-in-place order. So it really doesn't impact us that much. Certainly at work, but it will at home, because we all need to try to stay at home as much as possible. Certainly not travel. Limit the businesses that we go to. A lot of businesses are closed. Bars, restaurants, and things of that nature. Certainly restaurants, you can only call in and pick up the orders. So we're really trying to, with that order, really trying to keep folks at home. The president has said, stay home for the next 15 days. Those 15 days could be 30 or more. Hopefully they're not, but it could be. Some of the actions that in addition to what the county has done, is a number of departments have shut down access to the public. The recorder's office, assessor's office comes to mind because they're in the Hall of Records where I'm housed. We had to shut down all of our library branches, which we really didn't want to do, but when the direction from the CDC was to reduce the amount of gatherings with 10 people or more. We really had no choice, and it was consistent with what the cities of Clovis and Fresno did with their bars and restaurants. So, how can employees and how can we limit the spread of the virus? It's just follow our local public health guidelines. Wash your hands with soap and water. Sing happy birthday to yourself twice, which should be over 20 seconds. And wash like surgeons wash. So make sure you get your fingernails cleaned. And if you wash your hands for more than 20 seconds or 30 seconds, that's a good thing. You just washing your hands alone, it plays an important role not only in hygiene but certainly stopping the spread of this virus. In addition to that, keep your hands off your face. I have a goatee. I always want to touch my goatee, so I'm forcing myself to keep my hands down. Keep your hands off your eyes, nose, mouth, and again, always keep your hands washed. Try to avoid close contact with other individuals that are sick. And if I didn't mention, if you're sick, don't come to work. Not only during this situation, but going forward, we don't want sick employees at work. We want you to stay home, take care of yourself, get healthy, and come back and be productive when you're here. Another important thing is, again, practice social distancing as much as possible. Try to sit approximately 6 feet apart from your counterparts. We're really trying to put that in place in departments. Some departments it's harder to do than others, but we're doing the best we can. That's one of the reasons why they shut down the restaurants and movie theaters, churches, the whole 9 yards. Lastly, if you want more information on the COVID and our response as a county, refer to the HR website. This has been kind of an HR nightmare in terms of the amount of questions and how fast we're having to deploy these changes. I think our HR department's doing a great job. There are so many different nuances, so many different situations that are coming to our attention in terms of sick employees coming to work, employees that came back from outside the country, outside the state, and there's a lot of rumors going through departments about some employees who might be sick and rumors about them having COVID. The reality is we only have 6 confirmed cases in the county right now. Not to say we don't have more, but only 6 confirmed, and we really don't want any bullying or any inappropriate behavior towards these individuals who most likely don't have it. It's just not acceptable, especially during this time. Emotions are running very high. There's a lot of stress in the workplace that creates other problems, and please just do the best you can to focus on what you need to do and mind your own business and get things done. My ending comments before I take questions is, again, I just want to thank all the employees, especially one of the designated essential employees who are still here at work providing services. I really appreciate what you do and how you do it. And as I said earlier, it's our #1 goal to protect you, and while you're protecting you in the workplace, we're protecting the people that come in that we serve. And I just want to thank you for everything that you do. And I also at this time want to thank our management team for really going above and beyond the call of duty. As I indicated, as I went through the dates a lot has happened in 2-week time. And while we're working on a response to the community's needs with respect to the virus, we're spending a lot of time trying to foster safety and foster a safe working environment for our employees as possible. So again, thank you management for all that you do. I know it's not easy. A lot of people are putting a lot of hours in. Right now my brain function is probably at 32.6% at best. But we're here to do a job. I appreciate what you're doing, and I'll stop talking and answer questions. I'll start answering questions. Okay. I'll start on the top. At this point, it doesn't seem like the economy will be recovering anytime soon. how soon can we start seeing layoff notices for other measures to prevent County of Fresno from going bankrupt? You know, we're not even thinking about that right now. I don't want our financial condition to dictate how we respond to this virus. We are, we will make those decisions going forward. I don't see us laying off any employees anytime soon. We will, but that's something that we'll deal with when we get past this point, the next couple of weeks to a month. We'll look at what we need to do and go forward. The idea is to try to avoid layoffs and to help employees stay employed the best we can. That's certainly going to be a challenge, and maybe I'll come back to you in the next few weeks to a month to share what we're going to do going forward if we have to. The next question is, yesterday the governor said the next 8 weeks will be crucial in flattening the curve. With that little knowledge, how do you think this will affect the county and its employees if we take that to mean a shelter in place for 8 weeks? Well, right now, as I indicated earlier, we've shut the libraries down for till April 14th, which is a full 4 weeks. We're hoping that we will be in a much better position in 4 weeks from now, but it could get worse before it gets better. We'll take it, a week at a week, a month at a time. If it's 4 weeks or it's 8 weeks, we'll figure out what we're going to do going forward. And that's that. What's the procedure for when an employee tests positive? Will the entire building be closed? That's something that I would refer to public health. We haven't had any issues with our employees getting sick. Well, I shouldn't say that. Employees get sick all the time. The COVID is something that would need to be tested for and what have you. I would refer to, I'll have to get back to this group on how we would respond if we did have a COVID finding of an employee who's working here. But for now, we don't, and we'll figure it out if we have to deal with it going forward. Is the AN 511 agreement remain a requirement for employees in light of stay-home directive? I don't know what that means, so I'm going to skip that. Outside of the recommendations from the CDC, and other governing entities like public health, how can we as county employees and public servants best assist management and do our part to pull together in this time? I think that's a great question. Again, I refer to, if you want to educate yourself more about the virus, refer to the HR website. Refer to on the county homepage, on the top of the page, is a link to the public health website. Go out and take a look at that documentation. There's a lot out there. There's a lot of information relative to various aspects of this crisis. And if you want to perhaps volunteer or do other things above what you're doing on your job, contact me. I'll forward you to the volunteer section of our EOC, and we'll go from there. Has the county sent teams to rural areas to address the homeless populations in those areas? Well, we've been doing that for some time. We've been reaching out to the cities in our county because initially the focus of our homelessness efforts really were in the city of Fresno and downtown Fresno. And so we have reached out to all 14 cities outside of Fresno. We've all agreed, and their councils have approved 14-point objectives on how to deal with the homelessness problem. We've sent teams out of mental health practitioners and navigators and what have you to some homeless encampments in various cities. The reality is the smaller cities weren't aware that these services were available. They are now aware of them, and we are increasing our services out there. We recently cleaned up a homelessness site and helped refer some of the individuals to services out in the Parlier area, in the unincorporated area near Parlier, and we're going to be doing more and more of that. I'm learning, now I'm scrolling up. Okay. Since access to medical personnel is about to be extremely limited, what sort of time frame do people with underlying conditions have to get the documentation to you? Yeah. I'll refer. I've got Paul Nerlin in my office because there's some questions and/or a lot of questions I might not be able to answer, and I'll let Paul answer that one.
Good afternoon. We are talking several times a week with HR representatives in your department. We are aware that that might be an issue, and so we'll be issuing directives in that regard that will likely extend that deadline. We're aware that we don't want to do anything that's going to cause more strain on our providers, and so you'll likely see more information coming on our website and from HR reps soon. My message to employees would be, don't be concerned with that. We'll work with your department and your HR reps if you're having problems getting that information.
Okay, what is the next question? What is the county doing about the open courthouse? Does the county have power to shut it down to avoid people coming downtown? Well, first of all, the courthouse, the court system is run by the state. The county does have a good relationship with the current presiding judge and the administration of the courts. We had a meeting, I want to say Tuesday of this week. It was about a 1 to 2 hour meeting with our public safety departments, DA, sheriff, probation, and public defender with the courts to talk about things the courts were trying to do to reduce access to the courthouse, change some of the calendars so that we don't have to have as many people in the courts. And they recently came out with an explanation of the various changes that they're going to make. The courts realize that they can't shut down altogether, but they're doing the best they can to try to limit access to the courthouse. We're also working with administration and with our own internal team to try to provide as much safety equipment to our attorneys and other personnel that work in the courthouse so that they feel safe and wipe their hands and wash their hands on a regular basis. So we're very cognizant of that, but because the state runs the courts, we're not in a position to shut down the courthouse. Do we know which library employees will be called upon to staff the call center? I don't, but the librarian Ramon Bath does, so you can contact him. Do supervisors in each department have access to hand sanitizers for employees to use when entering and exiting buildings? How can we find out? I know that first of all, getting supplies ordered and received is challenging now. A lot of orders that we have are on back order. What we're trying to do, so some departments have hand sanitizers and stuff for their employees, and some don't have as much. What we're trying to do is inventory the county departments that have shut down or reduced the level of service or reduced their employees that are here, so that if they don't need their equipment, we can transfer that equipment to areas and buildings that need it. So we're in the process of doing that, and we're trying to rush some of the orders, trying to get think out of the box to try to get the materials in as quickly as possible. But a number of departments have expressed concern. We hear their concerns, we appreciate their concerns, and we're trying to rush the orders in as fast as we can. So be patient. The email sent this afternoon reminded us that we are disaster service workers. Are there currently any plans on the horizon to call workers to assist in any disaster services? We don't have any existing plans in place that will call individuals up. I know we are shifting, as the prior question about the library, the use of library staff, we're going to be using some library staff to man the call centers, and we're going to be using other individuals from other departments to do that. But as of right now, no, but it doesn't mean we're not going to need your help going forward. You know, I think we need to look at this as like let's say a baseball game, and we're probably in the second inning or third inning, and so we need to, and we don't know what lies ahead of us. If we have to call workers to help with disaster-related services, we certainly will. What happens if the city does into a shutdown? Do we continue to be considered essential? Yeah, that doesn't really change the definition of essential employees. I just want to remind you that I test departments to identify essential services. and I directed them to try to be as liberal as possible with having people work from home where it makes sense, and to help employees with daycare issues, employees with health issues, and our older folks over 65. So we're really trying to be as accommodating as can be. But at the end of the day, the individuals that are here at work are providing essential services, are considered to be essential, and they will continue to be. Will COVID-19 testing be available for employees? I've got what I think is only a cold, so I've been staying home, but don't want to return to work prematurely, especially if I'm not sure whether it is really COVID-19. As I said earlier, if you're sick, stay home, especially during this time. If you have concerns about your health, stay home for the 14-day quarantine period. But at the same time, the COVID-19 symptoms are similar to cold symptoms, and it's not something to take lightly. So just take care of yourself, and work with your managers. If you're not sure, call them and talk to them about if you have any questions. I'll go on to the next question. If the need arises, how quickly would employees be able to migrate to working at home? Would laptops be provided or an app to access our work computer from home? We're currently working on that. Our IT director, Robert Bash, and Brian Martin, who runs the IT, is looking at expanding our ability to have people work at home. Like I said earlier, I've directed departments to really liberalize telework in our county during this crisis. We also as a county are going to be going to laptops as a standard, but not all employees have laptops. So we have, as I indicated earlier, we're going to shift some library workers to a call center to answer calls. Brandy Orth has volunteered to let us use over 200 laptops throughout the county to help employees work from home, and that's just an example of how departments are working together to share resources to address this problem. Is there any mechanism to support extra help employees that may need to stay home during this time? Paul?
Hi, this is Paul, Director of HR. There is not currently a paid mechanism to support employees that are extra help. I know the departments are working to fully utilize the employees that we need at this time, and also those who can telework, but right now from a paid time off standpoint, there is not.
This is a very good question. Our department currently takes out Fresno State interns. Should this be discontinued at this time? I'm not sure what you mean by take out, unless you mean that you take them with you on ride-alongs and home visits. I would say if you're doing home visits or doing things outside of the office, I would probably discourage that. Now, if you have interns working in your department and you can properly follow the self-distancing protocols, I think that would be okay. If you have any questions, talk to your management about that. That's generally what I would suggest. Can we have voluntary furlough as an option for time off? I think that is something, if we aren't doing, we should consider doing. If you want time off and you're willing to take dock time, I think we're okay with that. We'd rather have you, but again, you have to work within your department and make sure if you're deemed to be a non-essential employee from an essential service provision perspective, then yes, I would say that's okay with me. Again, talk to your managers and so on, but I don't see a problem with that. Do you know if nearby counties like Tulare or Madera are also taking measures like Fresno County, specifically the shelter-in-place order? I have family members who are healthcare workers that travel between Fresno and Tulare. Well, Christina, I would tell your family members to take an abundance of caution when traveling between counties. Tulare County in particular has had a few local contracted cases that could be problematic. Again, as I said earlier, the less traveling you do, the better. And if you're going to travel, you follow the CDC guidelines as recommended by a local public health department. Now, are they taking the same measures? I don't really know what they're doing. Again, this shelter-in-place order was put in place by the governor. It applies to the entire state, including Fresno County. And so, again, you'll have to refer to your family members and ask them. I really don't know. And this is a kind of a delicate question, but I want to answer it anyway. Has the county arrived at any estimates or received any estimates as to how quickly the COVID will spread in Fresno County? We've not received any estimates, but the experts are saying that our numbers of confirmed cases will go up. We've not done, as I indicated earlier, I'm extremely frustrated with the lack of tests that are available to not only counties but hospitals in the state and the country as a whole. From my perspective, that's unacceptable. But it is what it is, and as we ramp up testing, most likely our numbers will go up, and that's where the self-quarantining, the following the hygienic recommendations of public health are so critical. Again, we can't control the testing issue, but we control what we do. And if all the citizens in Fresno County follow the shelter-in-place guidelines and limit their activity outside their homes, I think it will help reduce the eventual impact, whatever that might be. Is there a possibility that we could be pre-screened before entering our building? We're kind of doing some of that already in some of the buildings. We're asking, certainly individuals entering our jail and a few county buildings are being asked questions such as, have you felt ill in the last couple of days? Have you recently traveled outside the country or outside the state? Things of that nature to help try to filter out some of the more high-risk individuals. But it's pretty limited at this point, and because we're at such a low staff level and we have so many people out, it would be difficult to do in every county building. But it's certainly something that we can consider if we have to going forward. Well, I'm down to the last few questions. If small businesses have gift cards, this is more of a comment. If small businesses have gift cards available, purchasing those might be a good way to help them too. I'm assuming you're talking about local businesses. I would do that. Why not? We want to support our local businesses. We want to support our community. And if that's something that you can do and want to do, I say go for it. And the last two questions. If known, what are the plans or timeline for training for the volunteers for closed point of distribution in case it's needed? That's something I can't really answer. That's more of a public health question. Again, if you want to volunteer to help with our efforts in the community, I welcome your desire, and I would point you to the public health department for that purpose. And the last question, should we be doing inspections out in the public right now, or limiting them to emergencies only? I would talk to your direct manager and or supervisor about that. I don't really know the level of detail regarding that question. I would say that, generally speaking, if you don't have to do it, and it can be put off for a period of time, that's probably a good thing. But I'm not going to direct departments without knowing more details. So again, refer to your supervisor and manager. So that's it with the questions. Again, I appreciate everyone's efforts. I know this has been a very difficult time for all of you. I just want to reiterate that we're doing the best we can to try to mitigate the impact to our employees while still providing essential services that our community needs. And our number one goal is to protect your safety, protect the safety of the community. So please follow the guidelines that our public health department has put out. And God bless you, and we'll get through this together. Take care.